Chair recognizes the Leader of the Third Party.
Merci, Monsieur le Président. Well, Mr. Speaker, the only thing I can say about this bill to begin with is it's reckless. This is a reckless bill, Mr. Speaker, that puts at risk the public health care being provided in people's homes 24/7 now through Extra-mural. That's why it was invented. That's why it was developed. That's what it's been doing, Mr. Speaker, providing health care to people in their homes. And the Extra-mural nurses carry pagers, and they're available 24/7, Mr. Speaker. So you've got to say, why would you put that at risk? A service that has been widely lauded by all those who've used it and their families, Mr. Speaker, which explains in some way the tremendous opposition that exists to privatizing the management of the Extra-mural health services. These are essential health services. This is our hospital without walls, Mr. Speaker. The opposition is coming from organizations of all stripes, Mr. Speaker. The opposition is coming from individuals. In my own constituency, in my community meetings, just the other day, one of the issues that floated right to the top, Mr. Speaker, was people's opposition to seeing the management of Extra-mural health services privatized. So the question is, why does the government think it has a social license, Mr. Speaker, to go forward with this? It doesn't exist. Public opposition is widespread. You know, much has been done over the years to constantly, continually improve this essential health service, this service of our, based on our hospital without walls, our hospitals without walls, Mr. Speaker. So now, with the regional health authorities managing the Extra-mural services as they have been, you have seamless primary health care, Mr. Speaker. You have seamless care because nurses, nutritionists, physiotherapists, occupational therapists, all kinds of health professionals, whoever the person at home needs from their hospital without walls, can move from the hospital with walls, from inside to outside to people's homes, Mr. Speaker. Seamless, because they're managed by the regional health authorities, Horizon and Vitalité. So, if someone needs help from a physiotherapist from Horizon or Vitalité, from within the hospital walls, can move outside the hospital walls through Extra-mural to provide health care to that patient, Mr. Speaker. Just like the nurses do, just like the occupational therapists do, just like the other health professionals, Mr. Speaker, who work within the regional health authorities, within Horizon and within Vitality, within the walls of the hospitals, can move outside those walls through Extra-mural seamlessly, no problem. This mistake, Mr. Speaker, this error in judgment, Mr. Speaker, will create silos to prevent that from happening, because it sets up a Crown corporation or modifies the existing one that delivers and manages or that contains Ambulance New Brunswick, sets up a Crown corporation, a separate one, sets up barriers between the regional health authorities and that Crown corporation, which then is managed by Medavie Health Services, and it's many layers, Mr. Speaker. So it's going to create silos. It's going to create barriers. The seamlessness that exists now for primary health care in people's homes through our hospital without walls will be erased, and barriers will be thrown up. So the kind of health care, Mr. Speaker, that people now experience with our Extra-mural system as it is with this essential health service will undeniably change, Mr. Speaker. Undeniably change. We can see what's happened with ambulance services, Mr. Speaker. We have ambulance services managed by Medavie. There's over 100 paramedic openings, and service is suffering, Mr. Speaker. Yet, can we get the details of how much service has suffered, Mr. Speaker? How many times they haven't met their goals, Mr. Speaker? No, because that information is not accessible through a Crown Corporation. It's not accessible through the Right to Information Act. It is privately held, and so we can't know. So I fear, Mr. Speaker, I fear for what will become of the extramural health services when we remove the management from our regional health authorities to Medavie Health Services in this case, Mr. Speaker. This is extraordinary. When we're talking about $2 billion over 10 years. Now, with respect to Ambulance New Brunswick's budget, about 30% of that contract goes to Medavie or its subsidiary directly, so you can't find out how that money is spent. So let's say it's going to be essentially comparable, 30%. That's $300 million, Mr. Speaker, over 10 years, where we will have no information as to how that money was expended, Mr. Speaker, because that's the amount that's held that's held by Medavie or its subsidiary, rather than the rest of which gets spent on frontline services through the Crown Corporation, which will be, again, and I think this is important for people to understand, management occurs by the regional health authorities now. They manage our hospitals. They manage our hospital without walls. It's seamless. The management is going to shift through a Crown Corporation, which will employ the frontline health professionals who no longer will be working for the regional health authorities, Mr. Speaker, be working for this Crown Corporation, and then the management will be private. So it just throws up barriers, creates silos. It will diminish the quality of service currently provided by the extramural health program. Our hospital without walls will become a hospital behind huge walls, thick walls, which we will not be able to see through, and which will not be as easy for all the people who need that care to enter through, Mr. Speaker. One of the things this bill does, Mr. Speaker, is it fundamentally changes the purpose of the regional health authorities. It fundamentally changes the purpose laid out in the Regional Health Authority Act, which was for regional health authorities to provide for the delivery and administration of health care. If this bill went forward, Mr. Speaker, that purpose would be broadened to include the delivery and administration of health care by others. Now, why, Mr. Speaker, government doesn't see that that's a direct violation of the Canada Health Act is beyond me. Beyond me. To suggest, well, for this bill to change the purpose of the Regional Health Authority Act, change the purpose of the regional health authorities to include the delivery and administration of health services by others, the delivery and administration of health care by others. It's not just the administration, but includes the delivery and administration of health care by others, Mr. Speaker. It seems to me that flies directly in the face of what the Canadian Health Act says, directly contradicts the language in the Canadian Health Act, which says, in fact, this must be done publicly. So, Mr. Speaker, on this bill, I cannot support it in any way, shape, or form. And so I wish to make this motion, this amendment, seconded by the member for Fredericton West Hanwell, that the motion for second reading be amended by deleting all of the words after the word "that" and substituting the following. Bill 5, an act respecting extramural services, be not now read a second time, because privatizing extramural services has drawn broad public opposition, including formal opposition from many organizations, including the Vitalité Regional Health Authority, Égalité Santé en Français, la Société de l'Acadie du Nouveau-Brunswick, l'Association acadienne et francophone des aînés du Nouveau-Brunswick, the Coalition for Seniors and Nursing Home Residents' Rights, the New Brunswick Seniors Federation, the New Brunswick Union, and CUPE.